Pediatric dentistry. Pediatric dentistry, where kids are not little adults, where weight matters, anatomy matters, and you can't use the N-word. That's right, the N-word, needle. Stay tuned as we talk to a pediatric dentistry board certified pediatric dentist and faculty member about getting into pedo residency, what the ideal candidate is, and some tips. Stay tuned. Hey, this is Dr. Darwin, a new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into residency, and life as a new dentist. Guys, be sure, if you're enjoying this content, please down below, subscribe, like, and please share. Share to your colleagues and others that you know that you think the actual episode would be helpful for. Also, this episode is being brought to you by Dr. Darwin on Demand, but actually it's really being brought to you by getintodentalresidency.com. Getintodentalresidency.com, which is the ultimate place to get one-on-one help with your application so that you can get into residency, not now, but right now. For more details, go down below, right down here, getintodentalresidency.com. So today we're joined with a colleague of mine who's been in this game called pediatric dentistry for a long time. Today we're joined with Dr. Racquel Johnson, who's going to give us some tips and some more information about how to get into dental residency as a pediatric dentist. Dr. Johnson, how you doing?
Good morning, Dr. Hayes. How are you? Thank you so much for having me.
No, thanks so much for being a great resource to those dentists and dental students that are looking to become a board certified pediatric dentist like yourself. So before we get started, please introduce yourself. Tell a little bit about yourself for those that are meeting you for the first time.
Hi, everybody. So my name is Dr. Racquel Johnson, and I'm originally from New York City. I attended dental school at the University of Pennsylvania School of Dental Medicine in Philadelphia. And after that, I attended a GPR residency at Bronx Lebanon Hospital, which I believe the new name is now Bronx Care. And I attended a GPR residency for not 1, but 2 years. One of the best experiences of my life. And after that, I then attended my pediatric dental residency training at the University of Connecticut. Also a really, really good experience. And just a great time during my residency. I loved it so much. I could not see myself doing anything other than pediatric dentistry. One of the best decisions of my life, considering when I went to dental school, a lot of emphasis was being placed on implants and implantology. And so to go to pediatric dental residency, ultimately, I am just really happy with my decision to do that. So subsequent to doing my pediatric dentistry residency training, I had the honor and the privilege to be asked by Dr. Paul Gates to come back to Bronx Lebanon, now Bronx Care, to help them initiate their pediatric dentistry residency program. So I was one of the first faculty, the first inaugural class of pediatric dentistry residents at Bronx Care. So I am grateful for that opportunity to have, actually, that what has really started my journey into dental academia. However, I got the bug, and so I was very much interested in private practice. And so I was there for a year, and then I entered into private practice. I was working for several pediatric dentists in Southern New Jersey, and learning the business, learning how patients are scheduled, learning about dental insurance, learning how to staff your office. And I did that for approximately 3 years. I will say this, I stacked my cash, so saved money. And that afforded me the opportunity to then open up my own brand new practice from scratch. A daunting task. I was even asked by the architects and the company who built out my office, whether I even want a light switch, everything. So I was involved in every aspect of planning my practice, my 4-chair practice. And I was in private practice in my own office, solo practitioner from 2005 to 2019. And it was during that time that I actually got the bug again to really enter dental academia. And so during the course of being in private practice, I did pursue an MBA. And I was fortunate enough to enter into a program at Rutgers University Dental School, which was previously New Jersey University. And I get it all. I apologize. And all those who are graduates of UMDNJ, I apologize. UMDNJ, now Rutgers Dental School. And so I had the privilege of entering into a 2-year training program. It was a 5-year grant that several dental schools received. And I was the last cohort at Rutgers Dental School to teach practitioners how to enter into academia, dental academia. Because as a private practitioner, you are very good at what you do, running a business. However, teaching dental students is a whole new ballgame. So it was a 2-year training program, 1 day a week. The first year was focused on teaching us how to teach. And the second year was actually teaching dental students. And I was very fortunate to do that at the satellite clinics of Rutgers at Northfields and Somerdale in New Jersey. So I decided with that background that I wanted to pursue dental academia full-time. And so I left private practice and I entered into a faculty attending position. I was a dental attending at Nemours, AI DuPont Hospital for Children in Delaware. And I was there for a year, and I joined the exact same day as the inaugural class of dental residents. So Delaware did not have a pediatric dental residency training program. So I joined the same day as the dental residents. And so I was there faculty attending a brand new program and had the honor of actually being employed there. And it was a really good experience and learned a lot. Went to the OR teaching the residents how to manage children under general anesthesia in the OR. There was a lot of dental trauma, so the residents were on call 24/7, 365. There were times where I supervised the residents on call. There were times where the residents, given that there were only 2 residents, it was a very, I don't want to say a difficult program. It's a really good program, but having 2 residents, it required the faculty to also be on call. And so I experienced dental trauma on call and managed patients as well.
And
so that brings me to.
Yeah, as Gary said, it brings you to where you're doing now in academia as well.
So currently I am an assistant professor at the Meharry Medical College School of Dentistry. And I am also the postgraduate residency, pediatric dental residency program director. And so we are in the process of starting a postgraduate pediatric dental residency at Meharry as we speak. It is in the process of being started.
That's awesome. That's so awesome just to hear your story and your journey. And I know we've talked a lot in these last 20 plus years regarding pedo and private practice and academia. But so that's great. So we want to learn a little bit more about what it takes to be a pedo resident, what the ideal candidate is, and some tips. But before we go there, I want to kind of frame the discussion based on your experiences with pedo and why you chose pedo. So that's the question. Why pedo for you?
So I always knew that I wanted to be a pediatric dentist in dental school. However, that said, I wanted to get a really good foundation in all aspects of dentistry, and that is why I chose a GPR at Bronx Care. So for me, it was important to have that comprehensive understanding of the hard and soft tissues of a person's mouth. And so I received that training at Bronx Care. that for me, it is invaluable training. When I was in my own private practice, for instance, I extracted permanent teeth because I had lots of experience in my GPR. So what I recommend as a candidate is, and this is something that I experienced, you must, I can't overemphasize it, proofread your application. In the process of applying for Pedo Residencies, I made the inadvertent error of, in my cover letter, I had the correct name of the program director, but I inadvertently put the incorrect name of the school. And I did that on 3 applications. And I recognized the error, and it was something that I mulled over, and I decided, Racquel, you must make the call. You must make the right decision, call up the schools and apologize for the error. And so with those 3 schools in mind, and I didn't want to make those calls. I thought, well, they must realize that it was an inadvertent error. And in fact, it was important that I did that because with the University of Connecticut, I had, as I mentioned, the name Dr. Matthew in the cover letter, but I had the incorrect name of the school. And I called him and apologized. And it was actually the best decision that I made, because he later told me that my application went from the bottom to the top. And because he explained to me, on paper, everyone looks the same. Really good grades. Your personal statement explains why you want to become a pediatric dentist, all the things that you've done. And so he said to me that it separated me from other candidates, in that I'm the type of person, if I make a mistake, that I'm going to own up to it. And so
it sounds like one of the things that candidates have to keep in mind as it relates to what makes them an ideal candidate for pediatric residency is taking that responsibility when you inadvertently, unintentionally mess up on something, right? And
correct.
making and feeling empowered to make those hard calls on the telephone, making the decision to follow up on your application. But the takeaway is, ideal candidate wise, someone who is taking responsibility for their actions and not blaming it on somebody else or something else as well. What are some other things that
Yes.
make an ideal candidate?
So one of the recommendations I have is, if you are seeking to do a hospital-based program, that it may be in your best interest to do a GPR. And so to go straight from dental school, they want to see that you have some experience being on call, working with other professionals in a hospital setting, because when you're on call, you will be tasked with communicating effectively with nurses, communicating effectively with physician's assistants, communicating effectively with other residents, and communicating effectively with faculty of all disciplines. And so my doing a GPR and actually increase my confidence and ability to communicate effectively and working with others. So other tips that I recommend is, not only, again, proofread your application, consider doing a GPR or an AGD is fine. But again, if you're seeking a pediatric dental residency in a hospital-based program, consider doing a GPR. Also, make sure that you have really strong letters of recommendation. Be sure that those that you ask to write you a letter of recommendation, that it's someone who will communicate on your behalf why you are a really good candidate for residency. Also, make sure that you have experience working with children. I hear all the time from several students, well, I don't like removable pros, or I don't like dentures, so that's why I want to be a pediatric dentist. Well, that's really not one of the reasons why you go into something.
Right.
Really understand that as a pediatric dentist, you're working with children who can be challenging. We are the specialty that treats and manages patients with special healthcare needs. So you want to be well-versed in working with children who may come from all types of backgrounds, multiple experiences, and you want to treat those children as if that child were your own child. You're also going to be working with the parents. So again, understand that pediatric dentistry is very fun, but you're working with children and parents.
So children and parents, being able to interact with them, having those experiences, are good things for candidates to kind of have as part of their application. What with you being having the experience of being at three separate two separate programs and a future program that's under development right now. Um, you have had some experience dealing with residents and also residents that were already selected for the program, and also residents that potential residents or individuals that were going to be potential residents as well. Tell us a little
Yes.
bit more about what you as faculty and also as a program director are looking for related to those candidates that are coming that are applying to programs, to pedo programs.
Yes. So in terms of being a faculty member and having the opportunity to review applications for potential residents, so we look for, given that pediatric dentistry is very competitive, so we want to know that someone has the capacity and the ability to do really well in dental school and residency. So someone whose GPA is really high, especially again, if you're going to go straight from dental school into residency, because we want to ensure that you can meet the demands of the pediatric dentistry residency curriculum and be able to pass the boards. So your GPA is important. Experiences working with children, whether you've done that with, say, community involvement, I highly, highly recommend that you participate in activities in the pediatric dentistry department of your dental school. And so if you have the opportunity to attend the clinic more than, say, what your requirements are, and if there is a residency program at your dental school, work with or partner with a current resident and observe how they treat patients, work with the faculty in the department, because again, you want to show that your interest is there and that it's genuine. And so you're trying to understand and see how patients are treated. Also, if you have the opportunity to work with a pediatric dentist in private practice, you get to see how an office is run. So make sure that you expose yourself to these opportunities and these experiences prior to while you're applying or prior to applying. That way, you know that it's something that you're really, really interested in and that your heart is in it.
Yeah, and you make a good point about grades, especially for those candidates that are applying right out of dental school, because many may not have that experience or a lot of experience dealing with children, some of which you're going to get in residency, but also some programs anticipate that you've had a little bit more experience outside of dental school, especially if your school has a pedo program, because that means all those children and families and that population is going to the postgrads or going to the residents anyway. So you as a D3 and a D4 may not have those types of that type of population in your treatment plan family, I call it. So those grades are good, um, a great indicator to kind of help program directors in making those decisions. But I will tell you, I
Yes.
know those people that are listening right now that are like, well, I don't have good grades. I wasn't top 10 in my class. Outside of taking the ADAT, is there anything else that I can do? And it sounds like possibly considering doing a residency, an AAGD or GPR residency where you can kind of hone in some skills and also get some experiences will kind of help your candidacy when it comes to
Yes.
your application. Anything else you guys are looking for, program directors are looking for in candidates?
Well, again, just candidates with experience does help if you've done a fellowship. So places like Ohio State, the dental school there, have fellowship programs. There's a fellowship program in the Bronx at Rose Kennedy. Things like that that can give you experience with children, experience with the patient population that has special needs. Also, we consider applicants highly that have other degrees, such as a master's in public health or any other postgraduate degrees. So those things really do enhance and accentuate your application. But again, if you are the person that has done well and know that you want to be a pediatric dentist, absolutely apply. But again, keep in mind, make sure that you proofread your personal statement. We just frown upon there being errors and things like that. Make sure that your CV, your resume, again, is error-free. Take the time to proofread and make sure that it is really top-notch, because again, we are human and we make mistakes. And if you do make a mistake, you want to identify and atone for it. But again, if you can minimize any errors and things like that, because it kind of is a red flag that you may have a lack for attention to detail. And so keep in mind that those things are very important.
And that attention to detail translates to possibly giving the wrong type of medication, the wrong dosage.
Correct. Or that your treatment notes.
Yes, your treatment notes.
Because you want to, again, we can get really busy, or you may be on call and it's late and you're doing a treatment note. And if you have the opportunity to type in that note because you don't want to leave any details out, but then just keep it on the side. And then when you come in the next day, when you are refreshed and things like that, review that note and then sign off on it. Because again, documentation is key. And so your personal statement and your CV is like your documentation for your treatment note. Right. And so when we see errors, or when I see errors in how you present yourself, right, it just gives me pause to consider, well, is this person going to be exacting in their treatment notes? Is this person going to be exacting in communication with, say, another specialist in terms of managing a patient with special needs?
Right. So good segue for us as it relates to candidates, but also tips for the applicants. So you just hit upon a very important tip as it relates to your application, making sure that it's tight and right, making sure you are also getting, I think you mentioned getting, of course, great letters of recommendation. You want people that will unequivocally and not waive against being able to write you a superb recommendation. That's all you want. You want to identify who those superb individuals are that can write on your behalf with a very strong recommendation. So as we're talking about tips, what other things should candidates and applicants be mindful of when they're applying for pediatric dentistry residencies?
Make sure that you are aware of deadlines, in particular places that you like to really match with, because the deadlines I believe they have moved up. And so again, just in particular schools and hospital programs or combination programs that you may want to apply to. And so when I say combination programs, I attended what is a very academic program at the University of Connecticut, but it was also a very hospital-based program. And so you can have a combination or hybrid program. So consider the types of programs that you would like to apply to, know what those programs are, research the programs. It is your experience. And so you have to figure out what type of experience you like for your training. Do you want a program that does a lot of OR cases? Do you want to attend a program that gives lots of experience in sedation? Do you want a very academic program where you may have the opportunity to also receive a master's degree? So again, research the type of programs, reach out to current residents who are there. Also reach out to people who've graduated from the program. You can do that as well, who can speak to the experience. And so again, I am partial. I went to what I think is one of the best programs in the country. I am forever grateful to my program director. It was such that I didn't want to leave my program. I think that's the experience that you want to have, that the program gives you so much. I did a lot of OR cases. I did a lot of sedation during my residency. I enjoyed my anesthesia rotation for 4 weeks. I enjoyed the pediatric medicine rotation. We also had a very strong craniofacial team where I worked with the other members on the craniofacial team, the plastic surgeon, the geneticist, the orthodontist, the speech pathologist. I mean, that was such a wonderful experience. So I highly recommend that you research the program to understand what exactly the program is strong for. And a program could be strong in many different areas. I know currently now the training that residents receive for patients with, say, craniofacial anomalies and disorders is called a NAM appliance, a nasal alveolar molding appliance. Well, when I was a resident, we trained with using obturators. So again, it's all in what you like to learn, all in what you want out of your program. So I say highly research the type of program you're interested in. Talk to current residents, talk to people who've graduated from the program.
Yeah, and I think that goes a long way with researching. You also probably need to research some of the current research in the specialty and some of the current events that are going on, like you mentioned, the terminology or the different types of appliances that are being used now, all of which will help you not only in your personal statement, but also when you get to your interview, which is my next question related to tips. Interviews, people get the interview, they're excited, but they're also scared and fearful, almost like saying the N word, right? The dental N word, which is needle.
Right.
People get scared like that. So what are some specific tips if you had 2 or 3 things that you would tell people, tell applicants as relates to that interview day? Because usually it's 2 days, you meet with program director, faculty, you meet with residents, both formally and informally, if you have like a little social before or after the residency day. So specific tips as relates to interviews.
So what I recommend is so when you get that invitation for an interview, I highly recommend that you ask someone to interview you. So for instance, at Meharry, we have assisted our students who are interested in pediatric dentistry residency to do mock interviews. So see if where you're currently at dental school, if they offer mock interviews. If not, ask a trusted advisor, such as a faculty member, to give you a mock interview. If this person is in dentistry, it helps because they may know what questions to ask. But for example, when I interview students and potential applicants, I ask questions that don't necessarily have to do with dentistry. And so if you can find a trusted advisor who can offer you a mock interview, that's the way to go. That way, that may take away some of the jitters and help you in preparing for your actual interview.
Yeah, mock interviews.
Also,
anything? Oh yeah, go ahead.
Also, make sure that if you're traveling out of state, that you arrive in time, that you know that you can get settled in where you're going to go and not sort of be rushed. I don't know the status of the way things are now in terms of we are still in the throes of a pandemic. There may be virtual interviews that can work in many different ways. It may be more difficult to, and I don't like to use the word sell yourself with expression, but you will need to shine via a virtual interview. So practice, again, a trusted advisor, setting up a Zoom and just practicing a Zoom interview.
Yeah, and those are key.
For in-person, I apologize, Dr. Hayes, whether you're prepared for in-person or virtual. Go ahead, Dr.
I was just gonna say, no, that's key. You gotta prepare because you do your application so that you can get to the next step. The next step is being invited for an interview. And I think sometimes people will gloss over preparation for the interview. And if you guys have questions or need some help getting prepared for that next phase of this process for your applications for residency, when you get ready to receive interviews, put some comments down below If you are getting ready to get to that stage or want to get help with that, we have some one-on-one tools that we use and help candidates get prepared thoroughly for their interview process, for the interview day, as far as typical questions, what questions you should be asking Dr. Johnson and the rest of the faculty members and the dental residents as well. And then also how to kind of close out your interview so that your name always stays on top when the faculty are going through their selection process for match. So if you want some help with that, shoot me an email at newdentistcoach@gmail.com. So we're getting ready to wrap up, Dr. Johnson. This is some great tips. What's the best way for people to get in contact with you if they have some more questions about your experiences and you know what faculty members like yourself and program directors like yourself are looking for? What's the best way for people to get in contact with you?
I would say the best way to get in contact with me is via email, and I'll be more than happy to give my email. Would you like me to give that now?
Yeah, that's fine.
Dr.
Yep.
Hayes?
Yeah.
Okay, so the best way to reach me is my email. It's rjohnson7107@gmail.com. I will repeat that. It's rjohnson7107@gmail.com. I will be more than happy, and I would feel it is a privilege to help anyone on their journey to pediatric dentistry. We as pediatric dentists, there just aren't enough of us. So many children end up going to general dentist offices, and we need to work with our general dentist colleagues. We must work with our pediatric medicine colleagues, our endodontics colleagues. I don't do root canals on permanent teeth. However, I see children who have large extensive caries on their first permanent molars.
Yeah.
So we must work together to take care of all children, take care of as many children as we can. And so I will be more than happy to help anyone on their journey to pediatric dentistry.
Well, there you go, guys. Hopefully you guys got a great overview on how to get into Pedo Residency, and we've just revealed it. Pedo Residency revealed right here. Thanks so much for your time. We're about to roll out. This is Dr. Darwin. Love, peace, and smiles. We'll see you on the next video. Oh, check out these next videos right here. Check them out. Check them out. Bye.
Thank you all.